Welcome to the deep dive. Today we're going to be diving deep into dental anatomy.
Okay.
We're looking at it as like deciphering the blueprint of your smile,
Yeah.
and we're using notes and ideas from our listener.
Right.
Almost like a study guide for this deep
I
dive.
like that.
So imagine you're about to treat a patient,
Mm-hmm.
and they've got this really complex issue,
Yeah.
like a cracked molar
Uh-huh.
that's right near a nerve.
Oh, wow.
If you know your dental anatomy, like inside and out, it's like having X-ray vision.
Yeah.
You're going to be able to see everything and make the best decision.
Absolutely.
So
it's crucial.
It's super important.
Yeah, it really is the foundation for
Yeah.
every decision a dental professional makes.
Okay, so we all know that it's essential,
Yes.
but why?
Right.
What makes it so important for dental professionals beyond just passing those exams?
Think about it this way. Every procedure, from something as simple as a filling to as complex as like a root canal,
Yep.
hinges on you understanding those really intricate structures of the mouth.
Yeah.
Like if you don't know the exact layout, you're basically working blind.
Oh,
It's like trying
wow.
to fix a car engine without knowing where the spark plugs are.
Yeah,
You know?
that makes total sense.
Yeah.
So where do we even begin with this intricate map of the mouth?
Right.
What are the key areas that we need to be focusing on?
So first we need to understand tooth morphology,
Okay,
which is essentially the study of the shapes and the characteristics of teeth.
gotcha.
So think about the difference between your incisors, those sharp front teeth for biting,
Yeah.
and then your molars, which are designed with this broad surface for grinding.
Right.
So understanding those forms helps us to identify any abnormalities
Yeah.
and to choose the right treatments.
So it's not just about like knowing the names, it's about understanding how those shapes relate to their function.
Exactly.
Gotcha.
And then it gets even more interesting.
Okay.
We also have to delve into dental tissues. So those are the layers that make up each tooth.
Okay.
Enamel. It's
Yeah.
incredibly strong
Mm-hmm.
because it has this unique crystal structure.
Wow.
It allows it to withstand years of chewing. But when that structure breaks down,
Yeah.
that's when cavities form.
Right.
And then all sorts of dental issues come from that.
So understanding these different layers,
Yeah,
like the enamel, the dentin, the pulp,
exactly.
this is really going to help us diagnose and treat conditions like tooth decay.
Absolutely. Each tissue reacts differently.
Yeah.
Stimuli, it has varying strengths and vulnerabilities,
Interesting.
and interacts uniquely with other structures in the mouth.
Okay.
So that knowledge is key for effective treatment.
Okay, so we've got the shapes of the teeth.
Yes.
We've got the layers within them.
Right.
What else is crucial in this dental anatomy blueprint?
So then we need to like zoom out a little bit
Okay.
and consider the entire oral cavity.
Mm-hmm.
So the jaw bones, the tongue, the salivary glands, the muscles that are involved in chewing,
Wow.
like everything is connected.
Yeah.
And understanding those structures is essential for surgeries,
Mm-hmm.
for disease management, even something as routine as administering anesthesia.
It's like understanding the whole ecosystem of the mouth.
Precisely.
Yeah, not just those individual components.
Yeah. And then we have occlusion,
Okay.
which is the way that your teeth come together when you bite.
Huh?
Now, it might seem simple,
Yeah.
but if you have a misaligned bite
Yeah.
or a malocclusion,
Okay.
it can actually lead to problems like temporomandibular joint disorder,
Oh, wow.
better known as TMJ,
Yeah.
which causes pain and headaches.
So something as seemingly straightforward as how your teeth align
Mm-hmm.
can have this like ripple effect on your overall health.
Exactly.
Wow.
It can.
That's a good reminder to pay attention to even the smallest details.
Yeah, for sure.
What else is crucial to understand?
One last but very important element is the network of nerves
Okay.
and blood vessels that supply each tooth.
Gotcha.
This is particularly important for procedures that involve local anesthesia.
Mm.
You need to know exactly where to target
Right.
to make sure the anesthetic works effectively
Yeah.
and the patient is comfortable.
It's like having a detailed roadmap of the mouth's intricate wiring system.
Exactly. You wouldn't want to start poking around without knowing where everything's connected, right?
Definitely not.
Yeah,
But to be honest, this is a lot of information to take in.
right.
Are there any strategies or tips you can share that go beyond just reading textbooks?
Absolutely.
Something to make this knowledge truly stick.
Active learning is key.
Okay.
So think about using real-life models
Yeah.
or even 3D tools.
Okay.
You know, by interacting with the structures, you're reinforcing your understanding in a much more memorable way.
So instead of just passively reading, we're talking about getting hands-on,
Yes.
engaging with the material directly.
Precisely. And technology can be a game changer here.
Okay.
Like apps like Complete Anatomy or Anatomy 3D. They allow you to explore these incredibly detailed 3D models
Wow,
right on your phone or your tablet.
that's incredible.
It's like having a virtual dissection lab right at your fingertips.
I can see how that visual and interactive aspect would be so much more engaging
Yeah.
than staring at a flat diagram in a book.
For sure.
Are there other techniques that could be helpful?
Yes, so repetition
Okay.
and spaced learning are incredibly powerful.
Uh-huh.
So by reviewing concepts at spaced intervals,
Right.
you ensure that the information stays in your long-term memory.
Got it.
Apps like Anki can help with this.
So it's about consistently revisiting the material over time,
Exactly.
not just cramming it all in at once.
Yes. And another helpful tip is to utilize mnemonics
Okay.
and acronyms.
Mm-hmm.
They're great for remembering complex lists or concepts.
Right.
For example, you can use the phrase, "I did this last summer,"
Okay.
to remember the order of permanent teeth.
Oh, wow.
Incisor distal third molar.
That's a fantastic idea.
Yeah.
Mnemonics are like little mental shortcuts
They are.
to make information easier to recall.
Absolutely.
What about visuals?
Yes.
Are they important for learning dental anatomy?
Visuals are absolutely essential.
Okay.
Invest in textbooks that have high-quality illustrations.
Gotcha.
Dental anatomy, its relevance to dentistry is a great example.
Check it out.
And don't underestimate the power of online resources.
Yeah.
There are incredible YouTube channels and
Wow.
websites dedicated to breaking down those complex anatomy concepts.
I've seen a few
Yeah,
in visually engaging ways.
for sure.
Speaking of resources, what specific books, apps, or websites would you recommend
Okay.
for someone who wants to dive deeper into dental anatomy?
You're right. Having the right tools can make all the difference.
Yeah.
So for a comprehensive textbook, I would recommend Oral and Maxillofacial Anatomy by James L. Glickman.
Okay.
It's a classic for a reason.
Yeah.
It offers a really structured and detailed approach to the subject.
Classic and comprehensive. I like it.
Yeah.
Any other books that stand out?
Dental Anatomy, Its Relevance to Dentistry
Okay.
by Margaret J. Fehrenbach and Susan W. Herring.
Got it.
It's known for its clear explanations and detailed illustrations,
Right.
which are particularly helpful for visual learners.
Now, what about those mobile apps you mentioned earlier?
Right.
Which ones are your favorites for exploring dental anatomy?
Anatomy 3D is fantastic.
Okay.
It provides these really incredibly detailed, interactive 3D models,
Oh.
which are perfect for understanding how different structures relate to each other in space.
Oh, that's cool.
It's almost like you're holding the structures in your hand.
Sounds perfect for getting a really immersive understanding.
It is.
Any other apps you think our listeners should check out?
Complete Anatomy is another great option.
Okay.
What's unique about that one is you can explore the entire human body in 3D,
Wow.
which helps you to see how the oral cavity fits into the bigger picture.
Mm-hmm.
You can zoom in on specific areas,
Right.
highlight muscles, nerves, blood vessels.
Yeah.
Incredibly detailed.
Okay, so we have options for 3D visualization.
Yep.
Both focus specifically on the oral cavity and within the context of the whole body.
Exactly.
Pretty cool. What about websites?
Okay.
Any online resources that you find particularly helpful for studying dental anatomy?
KenHub is an excellent resource
Okay.
that's designed specifically for healthcare students.
All right.
They offer well-illustrated lessons
Mm.
and quizzes on dental anatomy,
Right.
which is a great way to test your knowledge
Yeah.
and identify areas where you need to focus your studies.
Quizzes are so helpful for solidifying knowledge
Yeah,
and seeing where you might have gaps in understanding.
for sure.
Any other websites we should add to our list?
Visible Body is another great one.
Okay.
Especially for visualizing anatomy in a dynamic way.
Gotcha.
So you can see how muscles move, how joints articulate.
Cool.
It really brings the anatomy to life.
Love that. Okay, so we've got books,
Yeah.
apps, websites. What about podcasts?
Right. Ours, of course.
Of course, the Dental School podcast
Okay.
covers a wide range of topics relevant to dental students,
Nice.
including interviews with professionals in the field.
That's cool.
It's a great way to get different perspectives
Yeah.
on dental education and hear from those working in the field.
Podcasts are such a great way to learn on the go.
They are.
Any other podcasts that you think would be beneficial for our listeners?
If you want a podcast that's focused specifically on dental anatomy, check out Dental Anatomy Academy on YouTube.
Okay.
They break down complex concepts into digestible chunks,
Gotcha.
using visuals and animations to make learning more engaging.
This is an amazing collection of resources.
Yeah.
I'm already feeling more equipped to tackle this subject.
But
But let's be real, even with all the best tools and techniques,
right.
staying focused and retaining this information can be a challenge.
It can be.
What tips do you have for making the learning process more effective
Okay.
and maybe even enjoyable? Creating a study plan is crucial.
Wow.
Dental anatomy is a vast subject.
Yeah.
So break your learning into manageable sections.
Gotcha.
Think of it like a meal plan for your brain.
I love that analogy.
Yeah,
So it's about pacing yourself
Yes.
and not trying to cram everything at once.
exactly. Be realistic about how much you can cover in each session.
Yeah.
And be sure to balance your study time with practical work or patient observation
Mm-hmm.
whenever possible.
Okay.
Seeing dental anatomy in action will help to solidify your understanding.
So it's not just about memorizing facts.
No.
It's about seeing how those facts apply in real-world situations.
Exactly. What other study tips can you share?
One of the most effective ways to learn is by teaching others.
That's a good one.
When you explain a concept to someone else, it forces you to really understand it yourself.
It does.
Any specific ways to incorporate teaching into the learning process?
You can share your knowledge with your classmates,
Right.
create study materials together, or even explain concepts to a friend or a family member.
Yeah.
Anyone who will listen.
It's amazing how sometimes talking it out loud can be the key to making things click.
It can.
Any other advice for avoiding burnout
Yes.
and staying motivated on this dental anatomy journey?
Remember to take breaks
Okay.
and stay positive.
Right.
Learning dental anatomy is a marathon, not a sprint. Regular breaks can actually help your brain absorb information better.
So stepping away from the books every now and then can actually make you a more effective learner.
Absolutely. And don't forget to celebrate your progress.
Right.
No matter how small,
Yeah.
a positive attitude can make all the difference.
Great advice.
Uh.
It's easy to get overwhelmed by the sheer amount of information.
It is,
But it's important to remember to celebrate those small victories along the way.
for sure.
Now, before we move on to part 2 of this deep dive,
Okay.
I think it's important to address some common mistakes
Yeah.
that people make when learning dental anatomy. What are some pitfalls our listeners should be aware of?
One of the biggest mistakes is cramming.
Oh, yeah.
Now, it might seem like a good idea in the short term,
Right.
but it's not effective for long-term learning.
Gotcha.
Spaced repetition is a far better strategy for truly understanding and retaining information.
So it's about consistency
Yes.
and spacing out your study sessions rather than trying to memorize everything at the last minute.
Yes. What other common mistakes do you see?
Another pitfall is rote memorization without understanding.
That's a big one.
Dental anatomy isn't about simply memorizing names and locations.
Right.
It's about understanding how each part functions
Exactly.
and how they all work together as a system.
Yeah, it's about understanding the why behind the what.
Exactly.
The more you understand the underlying principles,
Yeah.
the easier it's going to be to retain that information
Mhm.
and apply it in clinical practice.
I love that it's not just about memorizing facts.
No.
It's about understanding the bigger picture. Now, before we wrap up part 1 of our deep dive,
Okay.
do you have any personal anecdotes or experiences that you think might resonate with our listeners?
Let me think.
Something that helps you overcome a challenge or gain a deeper understanding of dental anatomy?
You know, I remember struggling with tooth morphology
Okay.
early on in my dental studies.
Yeah.
The sheer number of variations between teeth just felt overwhelming.
Oh.
But once I started using apps like Anatomy 3D
Mm-hmm.
and even physically modeling teeth with clay.
Wait, modeling teeth with clay.
Yeah,
That sounds incredibly creative.
it was fun.
How did that help you?
It allowed me to really see the patterns
Mhm.
and understand how the different parts of a tooth work together.
Yeah.
It was much more engaging and hands-on than simply looking at pictures in a textbook.
That's such a fantastic example of active learning.
It was.
It's about finding what works for you
Yeah.
and making the learning process more enjoyable. You know, it's inspiring to hear how something as simple as clay can be such a powerful tool
It can be.
for understanding dental anatomy.
It really is. And sometimes the simplest tools can be the most effective.
Well said. And on that note, we'll be back in part 2 of this deep dive with even more insights and strategies to help you master dental anatomy. Stay tuned.
Sounds good.
Welcome back to the deep dive. Before we jump into more of these tips and tricks,
Yeah.
I want to touch on something you mentioned earlier about how dental anatomy isn't just about the books.
Right.
It's about applying that knowledge in those real-life situations.
Absolutely.
Can you elaborate on that a little bit?
Yeah, you can read all the textbooks in the world,
Mm-hmm.
but until you see how those concepts actually play out in a clinical setting,
Right.
it's just theoretical.
So what would that look like for someone who's studying dental anatomy?
Okay.
How can they bridge that gap between the theory and the practice?
One of the best ways is through clinical observation.
Okay.
So if you have the opportunity to shadow a more experienced dentist, right, take it.
Yeah.
Seeing those anatomical principles applied in real patient cases
Mm.
is so valuable.
It's like the difference between reading about how to bake a cake
Yeah.
and actually being in the kitchen watching someone do it.
Exactly.
You learn so much more from that hands-on experience.
For sure.
So imagine watching a dentist administer local anesthesia.
Okay.
You see how they use their knowledge of the nerves and blood vessels
Mm-hmm.
to ensure the patient's comfort
You're right.
and the effectiveness of the procedure.
Absolutely.
That kind of real-world application brings the textbook to life.
It does.
Okay, so clinical observation is key.
Yes.
Are there other ways to get that hands-on experience,
Yeah.
especially for someone who maybe isn't yet in clinical setting?
Technology is a fantastic resource here.
Okay.
We're seeing some really incredible advancements in 3D modeling and even augmented reality,
Wow.
allowing for these incredibly realistic simulations.
Like augmented reality.
Yeah.
Like holding up your phone and seeing a 3D tooth superimposed on your hand.
Exactly.
That's wild.
Yeah, it's becoming increasingly accessible for students,
Wow.
allowing them to interact with these anatomical structures
Yeah.
in a way that feels incredibly real.
That sounds amazing.
It is.
I can see how that kind of immersive experience would be a game changer
It is a game changer.
for learning and practicing those dental procedures.
Yeah, for sure.
Okay, so we've talked about clinical observations.
Yes.
We've talked about technology.
Right.
Anything else that our listeners can do to really solidify their understanding?
I always encourage students to find ways to practice their knowledge.
Okay.
So don't just passively read the material, actively engage with it.
What would that look like?
Okay.
Any specific suggestions?
One simple but really powerful technique is to sketch anatomical structures.
Okay.
So start with a basic tooth,
Mm-hmm.
the crown, the root, the layers within.
Yeah.
Don't worry about making it perfect or being an artist. It's the process of drawing that helps to cement the information in your mind.
It forces you to think about the structure in a different way,
Yes.
translating those 2D images from the textbooks
Right.
into a 3D representation in your mind.
Exactly. And it's a great way to test yourself.
Yeah.
Can you actually accurately reproduce that structure from memory?
That's a good point.
If not, it's a clear indication that you need to go back and focus on those areas.
That's such a practical tip.
It is.
No fancy equipment needed, just a pen and paper
Exactly.
and a willingness to try.
Yes.
What about study groups?
Okay.
Are those helpful for learning dental anatomy?
Absolutely. Study groups can be so beneficial.
Yeah.
Bouncing ideas off of each other,
Right.
quizzing each other,
Mm-hmm.
explaining concepts to one another.
Yeah.
All of it helps to solidify the understanding
Right.
and makes the process more enjoyable.
It's about creating that collaborative learning environment
Yes.
where everyone can benefit from each other's strengths and perspectives.
Exactly. And don't underestimate the power of teaching.
Yeah.
If you can explain a concept clearly to someone else,
Right.
you truly understand it yourself.
So study groups offer a chance to both teach and learn from your peers.
They do.
It's a win-win.
It is.
We've covered a lot of ground today, from those learning resources to study techniques
Yes.
to the importance of real-world application.
Uh-huh.
Any final words of wisdom you want to leave our listeners with?
I would say the key takeaway here is don't be afraid to experiment and find what works best for you.
Yeah,
Learning dental anatomy is a journey.
that is.
There will be challenges along the way,
Right.
but embrace those challenges
Right.
and use them as opportunities for growth.
I love that it's about finding your own learning style
Exactly.
and making it work for you.
Yeah.
We'll be back in part 3 with even more insights to help you navigate this journey. Don't miss it.
Sounds good.
Welcome back to the Deep Dive. As we're wrapping up our exploration of dental anatomy,
Yeah.
I keep thinking about how much this field relies on three-dimensional thinking.
It really does.
We've talked about 3D models and apps,
Yeah.
but what about good old-fashioned hands-on learning?
That's so important.
I was thinking about that, like dental anatomy is all about visualizing these complex structures in your mind.
Mm-hmm.
So what if, in addition to those high-tech tools,
Right.
we encourage people to go back to basics?
I like that. What are you thinking?
I'm thinking sculpting.
Oh, wow.
Imagine taking a lump of clay
Okay.
and actually shaping a tooth.
Yeah.
You'd be forced to think about the crown, the root,
Right.
the cusps, the grooves,
All those details.
all those details we've been discussing.
It's a great idea.
It's like building your own anatomical models.
Yeah. And it doesn't have to be perfect.
No.
The very act of molding the clay
Right.
forces you to engage with the material in a different way.
It does. And it can be really fun, too.
It can,
It's a great way to take a break from the books and still be learning.
for sure.
So listeners, if you're feeling stuck on a particular concept,
Yeah.
grab some clay, get creative.
Yeah.
You might be surprised at how much it helps.
I agree.
We've talked a lot about individual learning strategies,
Yes.
but I'm also curious about the role of community in mastering dental anatomy.
Okay.
What are your thoughts on that?
I think it's incredibly important.
Yeah.
Learning doesn't have to be this solitary pursuit.
Right.
Connecting with others who are on the same journey can be so motivating and
Yeah.
enriching.
So things like study groups, online forums,
Mhm.
even just casual conversations with classmates, those can all make a difference.
Absolutely. It's about sharing knowledge,
Right.
asking questions, bouncing ideas off of each other.
Yeah.
Sometimes hearing a different perspective on a concept can be all it takes
Yeah.
for things to really click into place.
It's like having a built-in support system as you navigate this complex subject.
Exactly. And remember, everyone has their own strengths and weaknesses, right?
What might be easy for one person could be challenging for another,
Yeah.
but by working together, you can help each other fill in those gaps.
So collaboration and communication are key skills for any dental professional,
Absolutely.
and there's no better time to start practicing than now.
I agree with that. You never know. You might even make some lifelong friends along the way.
That's a great point. It's
Yeah.
about building a community of learners who support and inspire each other.
Exactly.
Well, I think it's time to wrap up this incredible deep dive into the world of dental anatomy.
It has been a fascinating journey.
We've covered so much ground, from the essential elements of dental anatomy
Yeah.
to practical learning strategies, valuable resources,
Mm-hmm.
and the importance of community.
For sure, we even got to explore the creative possibilities of sculpting teeth with clay.
That's right. I hope this deep dive has inspired you to approach dental anatomy with curiosity,
Yeah.
enthusiasm, and a willingness to embrace those new ways of learning.
I hope so too. Keep learning, keep practicing, keep connecting, and never lose sight of the incredible impact you can have as a dental professional.
Well said. And remember, the world of dentistry is constantly evolving.
It is.
So stay curious and never stop learning.
Thank you for joining us on the Deep Dive. We'll see you next time for another deep dive into a fascinating subject.